welcome back to the Is Healing podcast, a people's podcast. It is an interview podcast. Here we talk about frequency medicine, functional medicine, sex addiction, eating disorders, lots of topics. And our purpose here is to bring awareness to the people, to bring power to the people, and to help bridge people with resources and information that they wouldn't have otherwise. Thank you for being here today. I'm your host, Magnolia Heaton, and I'm a licensed clinical social worker. I am a sex addiction therapist. I am a multiple addictions therapist. I am an EMDR consultant in training. I am NET certified. And if you want any more information, you can look in the show notes. There's plenty of information there. On my website too. For today's episode, we have a returning guest, Amber Bowers. She is a holistic mental health counselor, integrative health coach, certified neuro-emotional technique practitioner, and eating disorder specialist based in Chardon, Ohio. She works with clients both in person and virtually worldwide, offering deep transformative support for those who have done it all and still feel stuck. Amber takes a whole person approach, integrating mind, body, and spirit through modalities like internal family systems, NET, contact reflex analysis, the Lebowitz protocol, and other integrative tools to uncover the root causes of emotional and physical symptoms. Her work is shaped not only by her personal healing journey through chronic fatigue and misdiagnosis, but also by her experience in working in community mental health and higher levels of care, including inpatient psychiatry and residential treatment. Today, she helps clients connect the dots between their nervous system, emotional patterns, and physical symptoms so they can finally experience real, lasting change. Let's talk a little bit about your experience in working with eating disorders. You have experience working in different levels of treatment, and you've seen a lot of things that you don't necessarily, I don't even know. Just have the floor, please.
Okay. Thank you. So I started working with eating disorders in 2017. So it's been almost 10 years now. I've worked with them in every level of care. So I started out working with them in inpatient psych, in a freestanding psych hospital as the eating disorder program coordinator. We had inpatient, PHP, and then I've worked with them in residential treatment, and also outpatient. And now continue to work with clients who struggle with eating disorders, but from a much more holistic lens. And so I'll share a little bit about kind of what that means to me and what the differences are. I found, there's a number of things when I was working with eating disorders that just kind of felt baffling to me when it came to, and not just eating disorders, also the general psychiatric patients that we were working with too, but especially eating disorders when it comes to, first and foremost, one of the struggles is there's a high co-occurrence between eating disorders and trauma. And in, I would say almost every, but most of the programs that I'm familiar with, have collaborated with, coordinated with, especially in higher levels of care, it's discouraged to work on trauma at the same time as someone's eating disorder, which personally I found fairly impossible as a practitioner. Oftentimes would, work on trauma with that client because it just was unavoidable. And just to give an example, like let's say there's someone with bulimia and the purging is what helps ground them when they're having a flashback, right? Like there's a huge overlap between those things. So it's really hard to separate those two things and only address one of them. The other piece that kind of baffled me was that clients are just not there, our hospital system. I'm sure anyone who's been in the hospital, whether it be psych or regular, is familiar with hospital food, right? Like most hospital food doesn't taste great. It has a ton of things added to it. It's not, what I would think of when I'm trying to help someone heal their mind and their body. And so that is something that, even unfortunately gets to a point where it gets discouraged, where, all food is good food. And I've even had clients that have gone through higher levels of care who then are nervous or anxious to buy organic food because they don't want to be labeled orthorexic. So I think it's something that's very nuanced. It's a very challenging thing to address as a practitioner, and even more so as someone trying to navigate that, right? Because they're being told all these different messages. Oh, if you do that, you're going to relapse. If you don't do that, you're not going to reach recovery, or, you can't consider yourself recovered if you're not doing X, Y, and Z. And so that is the biggest thing, is like, again, especially in higher levels of care where the food is being provided to them, they're eating 3 meals, 2 to 3 snacks a day, and it is food that just is not of high quality. It's not organic, right? It's not like what we would expect, which I'm sure very much is related to cost. And like, it's a business, right? Hospitals are making money, and so they also have to be mindful of what they're spending. But just the total lack of like addressing the gut brain connection was baffling to me.
And on some level, I'm sure that there's a lack of knowledge as well, right? There are a lot of monies that are involved in big pharma. So it's like, yeah, there's a business in keeping people sick, especially in a hospital
Mm-hmm.
setting. But yeah,
Yeah.
right. There are a lot of chemical reactions that happen with the intake of food. If you're eating seed oils, if you're spiking your blood sugar all the time, if you're even eating processed foods versus whole foods, it all makes a big difference, right? Or like all
Yeah.
the pesticides within the food. So it is hard. It's like a hamster on a wheel in that regard. Like you said, like I really think you did a really effective job of highlighting that dilemma. I mean, I want to be healthy, but maybe not too healthy because then I'll have orthorexia and then I'm going to be hyperfixating, blah, blah, blah. Like, it's
Mm-hmm.
rough.
Yeah. That, and the other piece is oftentimes programs will only give clients like 3 things they can put on a list of dislikes. And those are the only 3 things that they're guaranteed to not have. Now, then we would have clients come in where, it's not uncommon for someone to cut out gluten or cut out dairy because of their eating disorder. And also, we have to take into account that some people have true sensitivities to these things, which can be further exacerbating some of their mental health issues that they're struggling with, their physical things that they might be struggling with. Refeeding is a very challenging process. It's really hard on the GI system. And so when you're also eating things that you're sensitive to, it's going to be really challenging. Whereas, again, back to those 3 dislikes, you could also have allergies, but if you had an allergy, most programs have to have it medically documented as an allergen. So you would have had to have had some sort of blood testing to show, like, I have celiacs or I have, a dairy allergy. And so it gets really tricky too, of like, I just think about, gosh, if these, especially when people are in a very acute place, if we were able to test for sensitivities using frequency testing and honor those things and really address the whole body, not just, okay, let's get you weight restored. Like, if we can really broaden our perspective with that, I think that it would be just so impactful for clients.
I think what you're saying is that really what you'd like to see is a higher quality of care overall, higher standards.
Yeah, absolutely. I mean, and it's one of those things where, we see this time and time again in frequency medicine, functional medicine. No 2 people are the same. And so, yes, again, someone could come to me with the same diagnosis as the next person, and the root cause, what is contributing to their inflammation or what's contributing even to their eating disorder can be totally different. And so recognizing it's more than just feeding them and putting them on medication. There's so much more to that. And even with the therapy piece, using NET to work with clients to really get to some of those roots of their eating disorder and their thought processes and their relationship with their body can be so much more impactful than, challenging and reframing thoughts. around their body image or around food, right? Like it's not as simple as just them just eating. It's so complex.
There's so much trauma with that, and I can only imagine being in an inpatient setting, having an eating disorder, having a lot of trauma, having all these triggers. They're not addressing my trauma. They're just telling me what I can and can't eat, and I'm getting punished maybe if I'm purging. That sounds really tricky and borderline harmful, right? Whereas, like, if you did bring in the NET, maybe you're not necessarily processing the trauma. Sure, you're not using talk therapy, but you're getting out of the body, you're rewiring the nervous system, and you're using the homeopathy as well.
Mm-hmm. Yeah. Yeah. I mean, I've seen a big difference in even my clients. I've had some clients that worked with me prior to me using NET, and even just the shift, the deeper issues that we're able to get to, even when it comes to generational things and beliefs and how that is impacting their relationship with food. I've also had some clients with emetophobia that have come back to generational things or gone back to things in childhood that they would have never connected to that paranoia of vomiting, and had huge changes in the being able to lower that fear when it came to vomiting, and being able to eat without having that fear after even just a couple sessions of NET. Whereas again, like, to get at that at talk therapy of like, oh, when you were 5, you had the flu really bad, and then you were afraid to eat because you like it's uncomfortable to throw up, right? That it could take a while to get to that point, and some people don't have memories of that. So if they don't have a parent reminding them or telling them like, oh yeah, that happened when you were in kindergarten, sometimes it's really hard to connect.
Or like it's really hard to address it in therapy. I could say, Amber, maybe there's this connection between when you had 5 and you had the flu and you didn't want to eat or whatever. And the way therapy works, you'd be like, no.
Mm-hmm.
And then it's like, well, I can't really do that and I can't convince
Yeah.
you. And, but with NET, like,
Well, and even if they're like, yeah, like again, how do we access that in the body? Is we have to use something more somatic like NET to be able to actually neutralize that in the body. Because again, like they might, like you said, they might have that memory, they might know that connection, but then they still can't figure out how to neutralize that in the body. And so they're still reacting when they're faced with food instead of being able to respond more appropriately.
precisely. I have a CMAT, so Certified Multiple Addiction Therapist credential in eating disorders and also in chemical dependency. And in both of those trainings, they discussed GLPs and how miraculous of a drug that is. But I mean, it can cause a lot of harm. There are a lot of side effects. Yeah. What do you know about the side effects of that?
I mean, absolutely, it can cause a lot of side effects. I will say too, I mean, even just from like the mental emotional perspective, oftentimes if it's something that someone's even wanting to do when it comes to weight loss, I would want to make sure that they're addressing their relationship with food, their relationship with their body first. I have had clients who have come to me not on GLP-1s, but have come to me on other appetite suppressants, other medications, and have successfully, because they've also done the therapy, come off of those medications and been able to maintain their weight. I think, unfortunately, unless it's being used because it's medically necessary, there's so many side effects, even just from that mental emotional perspective of like, we're putting a band-aid on something. And I get it. Like even in the holistic space, sometimes it feels easier to go get a chiropractic adjustment or take supplements than it does to address emotions. And it doesn't make them disappear. And so I think it's just a band-aid for deeper issues, again, unless there is a medical need for it. And then obviously can lead to issues when it comes to bone density and your muscles. And I mean, that's part of the issue with eating disorders, is that when we're low weight, our body starts to eat away at our muscles, and your primary muscle is your heart. And so that is why there also is such a high rate of dying when it comes to eating disorders, why it's one of the highest when it comes to mental health diagnoses.
And a high mortality rate as well.
Yeah.
Yeah. How would I know if I have an eating disorder?
What I tell people with anything, right? Anxiety, depression, eating disorder, it's being able to recognize whether or not it's impacting your day-to-day life. So If it's something that you're always thinking about food, it's taking up your mental space so much that you can't be present with your family, or you are, having to plan ahead for your next meal, or you can't eat something without feeling fearful or going into panic or thinking about what it's doing to your body. Again, either from a health perspective or from a weight perspective, like with that fear of gaining weight, or that fear of like, if it's something more like a chemical, right? Like, yes, there's things that I don't incorporate in my day-to-day diet, and that doesn't mean I don't ever eat them. If you can, if you can show up and eat anything without any issues, I think that's huge. But like, if you're recognizing like, oh, I'm feeling really nervous, I'm feeling really anxious, I'm constantly focusing on my body, and it's impacting in any way your work life, your personal life, that is a time that I would definitely reach out and get an assessment and be able to explore that more. And I see this even in the holistic space with things like back to the orthorexia, right? It's basically like being very focused on eating healthy, and to the point that it's impacting your day-to-day life. Now, I also have clients who have had gut issues, who it might be more harmful for them to do an elimination diet or some sort of restriction than to continue to eat normally because of eating disorder history or because of what that does to them mentally, right? We're not going to be helping the SIBO if putting you on a SIBO diet makes you so anxious and stressed that it's impacting your gut.
Absolutely. And there's a test out there. Hopefully, people could find it. I'm sure they could get their hands on it if they really look for it. Called the EAT 26. And that's a screener, right? And just, I mean, yeah, if you're concerned, get help. And eating disorders are more than just anorexia and bulimia. It's also ARFID, binge eating disorder, diabulimia, OSFED, orthorexia. There's a lot of things out there, right? And then ARFID in particular has a lot of overlap with autism. So yeah, and OCD also has a lot of overlap. And
Yeah.
addictions have a lot of overlap with eating
Yeah.
disorders. There's a
Which
lot.
again is why I said in the beginning, like it's something that is so nuanced and definitely not a one size fits all. It really deserves a individualized approach.
Yes. And overall, they are really mystified. I know that as a mental health professional as well, there is a lot of gatekeeping around eating disorders, which I know we've had this conversation before. Like, listen, therapists are people too. And many therapists join the field because they have mental health issues of their own. And sometimes people tend to gravitate. Like, if I'm an eating disorder specialist, maybe having a history of eating disorder is not always the case, but like, that is very common. Just like if I were an addict working in addictions, that is also very common. It is very mystified. There's a lack of information out there for any mental health professionals that are listening. We need to do better, really. And we need to be talking to each other and connecting with one another. And do you have any final words for any patients that are in treatment to like help them ask the right questions to their therapist or raise issues?
I mean, I think the one thing, like, although I wish our higher levels of care were different, I also know that there are times where that's absolutely necessary. And again, it's like one of those where, same with if I had a client who was suicidal, I do everything that I can to keep someone out of a higher level of care, but I also don't want this message to make people avoid treatment too, because sometimes that's necessary. And again, it's like that is for some people going to do more good than bad to go to treatment. And so really weighing the pros and cons, and also not turning away from treatment because you're afraid that every eating disorder provider is going to be the same. Because I do think other providers do have more flexibility or are willing to approach it from a more holistic space and not have as much of that, I don't want to say fear mongering, but it's almost like the fear mongering around relapse and around recovery of like, you can support your body and support your mind at the same time. And there are people and providers out there that will help you do that.
Yes, there are plenty of providers out there for sure. Thank you so much, Amber. I really appreciate you being here for this episode. A reminder that this is not medical advice, this is informational. And so please do your own research, and thank you.
Thanks.
If you're interested in working with Amber and looking at her work, you can find her on Facebook or Instagram at Bowers Counseling and Wellness, and her website is bowerscounselingandwellness.com. Is Healing LLC also is opening up its own intensive outpatient program focusing on complex trauma, eating disorders, and addictions. Tell your friends and check it out. The links are in the show notes. See you next time.